Good evening. I'm Psychiatrist Jay Fawver, live from the Bruce Haynes studio in Fort Wayne, Indiana. Welcome to Matters of the Mind. Matters of the Mind is a live call-in program where you have the chance to choose the topic for discussion. So if you have any questions concerning mental health issues, give me a call in the Fort Wayne area by dialing 969-2720. Or if you're calling long distance, you may dial toll-free at 866-969-2720. Now, on a fairly regular basis, we are broadcasting live every Monday night from our spectacular PBS Fort Wayne studios, which lie in the shadows of the Purdue Fort Wayne campus. And if you'd like to contact me with an email question that I can answer on the air, you may write me via the internet at mattersofthemind, all one word, at WFWA.org. That's mattersofthemind at WFWA.org. And I'll start tonight's program with an email I recently received. It reads, Dear Dr. Fawver, do actors change their brain functioning when they assume the role of another character? Well, that's an interesting phenomenon because there's something called functional MRIs where you can have somebody play the role of another actor, put them in a scanner, and then see how their brain works. And indeed, the part of the brain that tends to be necessary to have your self-identity, you understand your own values, you know who you are as a person, is right here on the inside part of the brain called the medial dorsal prefrontal cortex. Medial meaning on the inside, dorsal meaning down below or up above. But the medial dorsal prefrontal cortex is an area that is important for the purpose of understanding your self-identity and how you interact with others. Now, there's a medial ventral prefrontal cortex, which means down below, which is right below it. Medial ventral refers to how you identify yourself and your own personal values, but it doesn't matter so much how it affects other people. So the medial ventral prefrontal cortex is a part of the brain where as an actor or actress, you shut down, and they've shown this in the MRI scanners, you shut down that part of the brain when you're playing the role of another character. And apparently the better actors or better actresses are the ones who can totally block out their own values, their own self-identity, their own personal history. And in doing so, they can take on the role of another person. Now, the medial dorsal prefrontal cortex, just above that, will indeed relate your values and your understanding of the world around you, but it allows you to socially connect with other people. So many people with autism, for instance, will have a hard time with the medial dorsal prefrontal cortex because they need that part of the brain to put their current thoughts into context with other people. So in the environment with whom they're interacting, they want to be able to maintain that understanding of how other people might take them. So people who have difficulty with socially interacting with other people will often have difficulty with that part of the brain that allows you to connect with other people. Now, the important aspect of the medial ventral prefrontal cortex, the part of the brain that allows you to identify your own sense of values and your own identity, the important thing about that is that when you have sensory input coming in and you have information that you're trying to comprehend, it will go through that part of the brain to try to help you understand how that information that you're receiving from the news, from other people, from your work environment, how that information is processed based on your own identity and your own values. So that's why for a lot of people it's difficult to rationally have them connect with objective information that's coming in if it doesn't agree with their personal values. And many people have this bias in their understanding, and that's called cognitive dissonance, where people will have difficulty taking in new information that might not agree with their own personal beliefs that they've established for a long time. How do you establish personal beliefs? Well, it goes back to early childhood development, perhaps how your parents believed, how your peers believed, the information you've taken in as a means of trying to identify who you want to be. So we kind of allow that identity to evolve over the course of time to give ourselves our own identity. That's the part of the brain that an actor or actress is able to shut down and be able to take on the characterization of another person. Thanks for your email. Let's go to our first caller. Hello, Jesse. Welcome to Matters of the Mind. Jesse, you want to know how young symptoms of bipolar disorder can exhibit themselves and how can it affect the quality of life if left untreated as an adult. Well, bipolar disorder is a phenomenon that we don't usually discuss until somebody's maybe 14 or 16 years of age. There are different types of conditions prior to that age where children can be unusually moody. Disruptive mood dysregulation disorder is a term that's used for young children and young adolescents who might have moodiness, and it's out of the range of what would be expected at that age, but it's not considered to be yet bipolar disorder. Now, if you have an adolescent who has a family history of bipolar disorder, you have a mother, father, brother, or sister with bipolar disorder, you might be suspecting that young adolescent might need more of a mood stabilizer as you would treat someone with bipolar disorder. But the value of establishing a proper diagnosis early on will tend to give you better outcomes in the long run. People with bipolar disorder typically will have a higher likelihood of divorce, more likelihood of losing their jobs. They have consequences because when they're having highs and lows, it'll give you difficulty showing up to work and interacting with other people responsibly. So if you can identify bipolar disorder at an early age, you're more likely to get the proper treatment initiated. But as an adolescent, perhaps, if you see those kind of symptoms emerging, you'd first want to look at the family history, if there's anybody in the family having similar symptoms, and then go from there. As a child and adolescent, you have to differentiate bipolar disorder versus attention deficit hyperactivity disorder. ADHD will give you moodiness, irritability, distractibility on a day-to-day basis, whereas bipolar disorder, those symptoms will come and go, and they're based on the person's mood. With ADHD, doesn't matter what their mood might be, they're going to have difficulty with attention span and distractibility. With bipolar disorder, it's entirely based on their mood, whether they're on the upside or the low side. Thanks for your call. Let's go to our next caller. Hello, Louie. Welcome to Matters of the Mind. Louie, you want to know, can anxiety affect the way you breathe, and can the way you breathe affect your anxiety? You know, Louie, I remember when I was in medical school, we would hear about these people coming in the emergency room and they'd be hyperventilating. When you hyperventilate, you affect your bicarbonate level in your system and it makes you extremely anxious. So hyperventilating and blowing out too much carbon dioxide can create a lot of anxiety. So if you're anxious and you hyperventilate, you can actually worsen the anxiety overall. So for that reason, some people just need to slow down their breathing. And if you slow down your breathing, where you take a couple breaths out, a couple breaths in, very slow, deep breaths, what you're trying to do is slow down your breathing overall. So it does go back and forth. It's thought that you can be more relaxed when you exhale. So if you slowly exhale and exhale very slowly, but don't breathe out a whole lot of carbon dioxide, just take your time on exhaling, that can be very relaxing too. So many breathing exercises will be, a couple breaths in, 3 breaths out, very, very slowly over the course of time, so that you're spending more time exhaling, which stimulates the parasympathetic system, which is the relaxing system. Inhaling will stimulate the sympathetic system. Exhaling stimulates the parasympathetic system. The parasympathetic system is the system that slows down your heart rate and can actually make you feel more relaxed. Exhaling will help with that, but you don't want to hyperventilate to the point where you blow out excessive carbon dioxide. So not uncommonly when people are hyperventilating, they're blowing out excessive carbon dioxide. They can have an acid-base imbalance in the body. They can get, their hands will curl up sometimes, and sometimes it looks like they're almost having a seizure when they're merely hyperventilating. But that is related to anxiety, makes the anxiety much worse. Thanks for your call. Let's go to our next caller. Hello, Jen. Welcome to Matters of the Mind. Jen, you had mentioned that your 17-year-old just began Zoloft, and she seems super fatigued. What's the adjustment period for anxiety medication? I don't like to hear about people having to go through an anxiety or an adjustment period like that. Jen, if your 17-year-old is really tired on Zoloft, she's probably getting the dosage is a little bit too high right now. It's 25 up to 200 milligrams a day will be the typical dosage for Zoloft, also known as sertraline. And it's a medication that's increasing serotonin. If you increase serotonin, it can have a remarkable effect in helping you feel calmer and not being so bothered about things. And if you get too much of a medication like Zoloft, which is a serotonergic medication, you can feel like you don't care. That's not a good feeling. And you don't feel happy, you don't feel sad, you just feel kind of flatline. That's not a good feeling. If you're really tired, you right off the bat want to talk to your daughter's clinician about possibly decreasing the dosage. I agree that it might take 2 or 3 weeks for you to get over those initial side effects. I don't like people to endure those side effects at all. I'd rather just slowly increase the dosage as opposed to starting with a higher dosage and waiting out the symptoms, because that's not pleasant. And feeling fatigued is something that's not necessary. Starting with a lower dosage and then going up gradually over the course of 1, 2, or 3 weeks can often be helpful. So the key with Zoloft or sertraline, it can do a great job for anxiety and for some people depression, but it's a very good medication for anxiety particularly. But the key is to take the dosage that helps with the symptoms but doesn't make you feel fatigued or doesn't make you feel like you just don't care about things. Jen, thanks for your call. Let's go to our next caller. Hello, Grace. Welcome to Matters of the Mind. Grace, you want to know, are there any management symptoms that can help your mother with her hoarding? And should you look for other ways that her obsessive-compulsive disorder might exhibit itself? It used to be thought, Grace, that hoarding was a type of OCD. Now we kind of look at hoarding as being a little bit different phenomenon than true OCD. And that's kind of an academic discussion in itself. The key there is that hoarding would not be so responsive to serotonin medications, where OCD medications are very effective for in treatment. So you can use OCD medications like sertraline or Zoloft, which I just mentioned, and other serotonergic medications to treat OCD, but they won't help with hoarding so much. So there's a little bit of a differentiation there. So with hoarding, the key would be how much is your mother willing to give up, and sometimes it's a matter of negotiating things. The reason people will hoard and gather things is because they look at the values in which their hoarding is being personal belongings and its personal attachments. So when you ask somebody to throw out a bunch of magazines, it's almost like telling them to take one of their arms off, because it's something that they personally have been attached to. They look at it as being an identity. They look at the hoarding of objects as something that if they give up part of themselves. So you need to chip away, perhaps with your mother's permission, of the different things that she would be willing to give up. And people will hoard and they'll be more attached to some objects versus others. So you chip away piece by piece. You can logically try to have her assess what she really needs and what she doesn't need, and try to go very, very piecemeal in that way. But it's very difficult to get everything out of the house all at once, because there's a tremendous amount of anxiety associated with that, because it's considered to be something that is a personal belonging, and all the hoarded objects will often be something that will be identified as personal attachment. So it's very difficult to give that up. But it can be done, but the key will be do it very gradually and piece by piece with her agreement. Thanks for your call. Let's go to our next caller. Hello, Barb. Welcome to Matters of the Mind. Barb, you've heard me talk about kinesthetic learning and how it works. It's how some people are wired, Barb, and we see a lot of this with people with ADHD, but not everybody. But some people are just better learners if they're moving. And what I'm talking about is if they're moving around, if they're walking and talking with somebody. Some people can learn very well with auditory learning. Some people are good visual learners, but some people just do better if they're standing up and they're walking around. We see this all the time with people who are able to listen to lectures that could be quite boring, quite frankly, but they're doing so while they're on a treadmill, or they're on an elliptical, they're on a bicycle. And if they're moving, there's a different part of the brain that generates the memory downloads, and if they're moving around, it's called kinesthetic learning. They can actually comprehend things better. So if you have an adolescent, for instance, or a child in grade school, they're trying to learn different things. A grade school child, for instance, trying to learn their spelling, sometimes going out and shooting baskets with them as they're learning the spelling. And learning history as they're doing something physically active can be very helpful. And we hear about this a lot of times with cross-country athletes who are often very good students. Cross-country runners typically are very good students because they're disciplined, because they have to maintain a running schedule, but also it might have something to do with their thinking about their studies while they're running, and in doing so, they're downloading the information a little bit better. So some people just notice that they can learn better if they're moving around. Thanks for your call. Let's go to our next caller. Hello, Kendall. Welcome to Matters of the Mind. Kendall, you wanted me to discuss the stages of brain development and how you can support brain health. Kendall, early on in a child's life, the front part of the brain is still growing, very much so, and the front part of the brain continues to grow until you're about 24 years old. As the front part of the brain grows, that's the part of the brain that you're using for judgment, impulse control, trying to decide what's right and wrong, trying to decide what kind of values you have in life. It's the front part of your brain that's developing your identity, and that part of the brain to which I referred earlier, the medial ventral prefrontal cortex is part of that brain that's developing. That's where you develop your values, your sense of identity, your desires in life, your goals, and so forth. And it's very important in terms of developing as an adolescent and young adult. So I'm often telling adolescents and young adults to not be so definitive in terms of your life plans when you're an adolescent, because a lot of that can change. Even your identity, the direction you want to go. You're highly influenced by your peers, your authority figures as a young child, and that's part of the downloads you're getting there in your brain. But as you get older, a lot of times you can start to question and verify if some of the things that you learn from your peers in early childhood are really valid, and you can start to physically change that part of your brain just by rationally, objectively looking at the world around you. So the key in early childhood development will be try to keep learning things, keep yourself open to new ideas, and understand different things around you, and question. I'm always emphasizing to adolescents and young adults to question the world around them, question the whys. Just don't take in information blindly because somebody in a professorial position might have told you something. Ask them why they believe that. How did they get that information? And don't be afraid of offending adults by asking those kind of questions. I know in the Japanese teaching environment, that's actually expected, that you are to question your teachers, and that's actually a very good way to learn. Very importantly, and I'm telling this a lot to individuals who are children and young adults, adolescents nowadays, will be to not smoke marijuana. I know it's getting much more prevalent out there, but marijuana will slow down the growth and development of that front part of the brain, probably more than anything else we know, more so than alcohol, more so than cigarette smoking. Marijuana smoking will be something that's very, very damaging and delaying that frontal lobe development, and sometimes that can be irreversible, where it's going to be an ongoing problem for a lot of people. Exercising is very good for brain development, so getting into some kind of physical activity as a child, adolescent, young adult, and trying to maintain that kind of expectation as the years go on can be very helpful, because exercise not only helps learning, but it also helps with brain development in general. So there are some ideas that you can follow. Be careful about social media. Be careful about the digital environment in which we live. It's better to socialize and interact with people face to face as opposed to interacting by social media. Brain development has shown that with MRIs, as people are using more digital media, this part of their brain called the hippocampus can actually shrink. And I'm hearing about this particularly with AI, using AI now, where you can simply ask artificial intelligence a quick question about something, you get the answer. A lot of times you can forget the answer within 5 minutes because AI was so quick in getting you the response. So you can look at an answer on AI and within minutes forget what that answer was because it was so convenient. So be careful about digital media for learning and development. Try to interact, try to talk with other people. One of the best ways to learn will be to have discussions with people, whether it be on religion, politics, social goings on. Having conversations with people in a real-time manner can be very, very helpful, as opposed to going to social media and arguing with strangers about different things. That's not a good way to help develop the brain. So thanks for your call. Let's go to our next caller. Hello, Curtis. Welcome to Mayor's the Mind. Curtis, you want to know about the difference between flashbacks and a feeling of deja vu. Flashbacks will be where you have experienced a traumatic experience and all of a sudden those visions or the sounds of that bad experience are all of a sudden coming back to you. That's called a flashback. So it's something where you actually see or you hear something that happened before, and all of a sudden you're seeing it again. It's part of your brain's way of having difficulty processing that memory because it keeps bringing that memory back to you. Deja vu is an entirely different phenomenon. Deja vu is a very brief feeling, valid or not, that you've been doing something that you're currently doing, but you've already done it. So deja vu is a phenomenon where the so-called paralimbic system, which is right beside, that's what para means, paralimbic system is right beside the hippocampus here, and that part of the brain will sometimes fire off when somebody's having a deja vu experience. It could be related to a stroke, it can be related to a brain injury, a past infection, but something can fire that particular part of the brain right beside the hippocampus, beside the limbic system, and in doing so, it can make you all of a sudden feel like you've encountered that kind of experience exactly as you're doing it now. So it's kind of like a false memory in that way, and it feels very real when it's happening, but there are some physiological reasons for it happening, but it's an entirely different experience than flashbacks. Usually a sense of deja vu is not an unpleasant experience for people. They just kind of will briefly sit back and say, I feel like I've experienced this before. That's deja vu, happens over the course of maybe a few seconds, maybe a few minutes even, but then it will fade away, and it's not usually going to cause you anxiety, whereas flashbacks are something we're often trying to diminish either through therapy or medication treatment, because flashbacks can be very disturbing for a lot of people. Thanks for your call. Let's go to our next email question. Our next email question reads, Dear Dr. Fawver, why do I have such a letdown after vacation and Christmas? There's actually a reason for that from a brain standpoint. When you are anticipating something, you're actually going to have more dopamine release from the middle part of the brain than you would as compared to if you're actually experiencing it. In other words, Christmas is a good example. So many people say they get really excited for Christmas starting in mid-November. And then you go through Thanksgiving and you're starting to think about Christmas. Then you have Black Friday where you're starting to buy things for Christmas. Week by week by week, the excitement is building and building and building prior to Christmas. Well, what's happening during that time? You're getting a dopamine release. You're getting a feeling of joy, happiness, pleasure, and you're getting a physiological excitement during that time. The actual experience of Christmas itself, after all of this buildup, is often a letdown because the dopamine starts to go down because the excitement and the experience is already here. So whether it be Christmas, a vacation, if you're getting ready to do something and you're getting excited about something in the future, yeah, that can actually be more exciting than the event itself. Even though the event itself has a lot of meaning to you, the build-up to that particular event can often release a lot more dopamine than the event itself. And we hear about this a lot with drug addictions. People who are addicted to various drugs will have a lot of excitement in their brain, and the dopamine releases there preceding their use of the drug. The use of the drug itself might give some brain changes itself and affect the brain chemistry, but the excitement and the anticipation of using that drug of abuse often will give somebody much more joy and happiness, and that's why when drug addiction treatment is undergone, you're trying to decrease all these different type of collateral events that precede the use of the drug, because those are the events that will often trigger relapse. So you have to try to keep those all in check. Whether it be Christmas, a vacation, something that you're anticipating in the future, what I often recommend to people is try to have things available where they can look forward to things. You know, you want to have some kind of schedule in mind, and I tell this especially to people who are unemployed, people who are retired, people who wonder, what am I going to do this next week? Have something in mind, have something to do. Even if it's to socialize regularly with people, have something that's available to do fun, something you can look forward to doing, because when you look forward to doing something, you're getting that dopamine release, and that is helping the mood. Thanks for your call. Let's go to our next caller. Hello, Casey. Welcome to Matters of the Mind. Casey, you want to know, are there any mental health benefits to keep music and art in school curriculum? Music and art have their place, and I understand with school curriculums, there's always a debate, what should you include, what you should not include. So when you talk about the arts, yeah, music and art are different than the STEM environment, where people are learning science, technology, engineering, and math. So the STEM environment are more technically oriented. Math and art are different, so it's all a matter of people's preferences on what direction they want to go. But there's a lot of ways that people can learn. They can do a lot of extracurricular activities in any of those type of things that are left out of the formal school. Thanks for your call. Unfortunately, I'm out of time for this evening. If you have any questions that I can answer on the air, you may write me via the internet at mattersofthemind@wfwa.org. I'm Psychiatrist Jay Fawver, and you've been watching Matters of the Mind on PBS Fort Wayne, now available on YouTube. God willing and PBS willing, I'll be back again next week. Thanks again for watching. Good night.
The preceding program on PBS Fort Wayne was made possible in part by
Cameron Psychiatry, providing counseling and care for those that may struggle with emotional and behavioral challenges. More information available at CameronMCH.com.